Turkish doctors strike for 2 days following Dr. Ekrem Karakaya's murder. Yesterday, cardiologist Ekrem Karakaya was assassinated while on duty by a patient's family. Murderer committed suicide. Staff ceased working after the murder. Turkish Medical Association, TTB, Hekimsen, and SES unions are protesting today and tomorrow. They rightly hold the government accountable for the rising number of assaults on healthcare workers, and they are asking that appropriate action be made in response. World Socialist Web Site criticizes the assault and demands for a working-class campaign in defense of health workers. The government of Turkish President Recep Tayyip Erdoan and governments all over Europe and the Middle East don't care about healthcare workers' needs or the needs of the working class as a whole. In the face of a fresh COVID-19 outbreak, workers and youth must rally in support of health professionals. Dr. Karakaya's murder upset tens of thousands of healthcare professionals and other employees. After the murder, social media was nearly totally about it. Healthcare workers and their supporters condemned unions and TTB's decision to strike for just 2 days and advocated for an extended strike. Initial official responses to the murder fueled widespread outrage. Health Minister Fahrettin Koca, disgraced for his strategy of mass infection and death in the COVID-19 epidemic, was condemned for his ambiguous comments on Twitter. Resignation calls are growing. The government enforced a gag order on reporting about the murder in a Konya court because it was being debated by millions. Thousands debated the subject online. Recent articles published in the media shed light on how the targeting of healthcare professionals by the government and the impunity afforded to those who commit acts of physical violence. Professor Koray Basar, a former Turkish Psychiatric Association president, was assaulted Monday. The killing of Dr. Karakaya and the rising number of assaults on Turkish healthcare professionals can only be understood through the lens of the wider capitalist crisis.